Okay. In 2013, just after I took over, we actually received 8 cents increase in petrol and a 4 cent increase in diesel. And then that brought actually the total fuel levy that we received from the Ministry of Mines at 47.7 cents for both petrol and diesel. And that was really the last increase that we received. We really felt, because of the strategy that we have in place, at 47.7 cents it will do. So we haven't received any increases in the past 3 years, and we are still fine. Our projections, we really look at the levy that we have, and then we look at the volumes that we expect in terms of sales. Obviously, our experience has been when fuel drops, there's consumption goes up because it's cheaper. A lot of people can fuel their cars. So we also look into that throughout the year. How many times will fuel drop or go up? Those are the things that we take into consideration, and then we project what we are to receive for that year. Our claims expenses have been on the increase. You would appreciate that our business is all about claims. So the moment the crashes increase, we feel it immediately here. The types of claims that drive our cost is really medical expenses and then the injury grant. For instance, in the past 6 months or so, we've seen a spike in our injury grant. It indicates the increase in crashes. It indicates the extent at which people are it's really serious injuries. And then the medical expenses, we know that as much as we want to treat, we've said it a lot of times through the media that we're going to prefer state facilities. The services there are limited, the expertise are limited, the facilities are limited. So there are a lot of cases that we have to transfer through state facilities. And we know that good treatment does not come cheap. Specialists do not come cheap, and hence the increase in our medical expenses. In terms of funding, that's really improving. Funding has an effect on solvency. If we are well funded, overall it also affects our solvency. And that's why we say with the 47.7 cents we can make do, unless something catastrophic really happens. Hence our focus on really working with the partners and other agencies in road safety, so that we can bring the crashes down, because those are the areas that really affect our financial sustainability. But also there's now a lot of emphasis on investing. Whenever we have something little left, we invest it, and the returns that we are getting in that is really improving our assets as well.
Can you shed a bit of light on your investment policies? What areas are you looking at?
Yeah.
Is it in Namibia? Is it outside Namibia?
We do it through asset managers, so we don't do it directly. Well, the short-term investments through the local banks, we're still not investing outside Namibia, save for what the asset managers are doing. Our investment policy allows for about 50% to be invested through the asset managers, and we have 2 companies that does that for us, each having 25%. And then the rest we just invested with the local banks, but we actively monitoring that so that we actually get maximum return out of that. And because that area has improved significantly, we want to invest a bit of time in that, in the sense of getting an investment manager who actively spends every day researching the market, and also just like you're saying, are we just investing in Namibia? Looking also elsewhere, how can we get more returns? We can't just copy and paste. We have to look at our risk appetite. We also have to look at how far we want to expose the fund, seeing that we just started in that area. So we are busy studying all of that. The idea is not to make our books look good. The idea is to ensure that the fund stays there for years to come, and that every person who's injured on our roads in motor vehicle crashes is guaranteed that when I approach the MVA fund, there are funds to treat me, there are funds to rehabilitate me. That's really the idea. And also, as we're going, if you look at our benefits, they have been stagnant for years. Yes, they are enacted, but a lot has changed over the years. The cost of living has changed. The cost of treatment has changed. So as we go on, we also want to see improvement in the benefits. We don't have such a big problem of clients who are exceeding their benefits. But in the past 3 years, we've had about 5 clients who have depleted their funds. Imagine you're being treated and then the fund says, sorry, this is it for you. You've hit the ceiling and we cannot go forward. And the cost of treatment is going up. So you'd want to see a situation where the financial situation of the fund is so sound that you can actually make minor improvements as you go along to the benefits as well. Any death on our roads, it basically affects us. Any death on our roads. We want to see a situation where we really see the statistics going down. I must say that it was really exciting towards the end of last year when we all as stakeholders came together and we really aggressively went on the road with one voice and we really saw the crash statistics coming down. However, in terms of continuity throughout the year, that's what's required. You will need this area that's very important to our country to be sufficiently funded and given sufficient attention. There is a lead agency. I don't want to cloud that. The National Road Safety Council is responsible for road safety in the country. The only reason why the MVA fund gets involved is very simple. When everything fails, MVA fund comes in. And we say we cannot just sit down and wait. We have to be involved in prevention as well. So there's a certain percentage that on a yearly basis we actually put aside for accident and injury prevention. It's not like we have a full budget on road safety. No, we don't. However, you would want to see the council fully funded to an extent that throughout the year there are road safety activities. Peak seasons are well covered, and then that there's that synergy between all the partners to ensure that the statistics remain low throughout the year. It's really, really going up. I must say there was a year that we managed to reduce them to 8 million. And you could look, there's a correlation between the statistics, the cost of treatment, and then what we pay. But then immediately we're 10 million and they jump to 14 million. At 15 million now, it's not really sustainable. It's not really sustainable. We have to reduce that cost. Otherwise, we have to get into something that's affordable. Hence, we are also looking at the MVA fund getting involved in sort of a trauma center. There are countries that actually have hospitals that are purely, or trauma centers, purely for motor vehicle crashes. We visited one recently, and we're actually thinking of doing the same for the fund, where all our patients go to this facility. And in the long run, you'll see our medical costs. We can control it actually, so.
If 15 million is not sustainable now, what is your outlook for 2016, 2017, given the rate of crashes?
Hence, we have to reduce the crashes.
But what is your outlook? 2016, are you positive about that?
It won't happen now. It won't happen now. Hence, we are looking at the crashes. We are concentrating on reducing crashes. It won't happen now. We're looking at the next 3 years. If we really put our heads to it, our hands into it, we really believe that we'll reduce. But in the meantime, we're also looking at what is Plan B. And Plan B for us is really to concentrate on how we can actually control the medical costs, which is through the trauma center.